A 72-year-old man presents to the emergency department complaining of chest pain which started whilst gardening. A 12-lead ECG is performed at triage. What is the diagnosis? Options are A. Anteroseptal STEMI, B. Anterolateral STEMI, C. Inferior STEMI, D. Posterior STEMI, E. Anterior non-STEMI. The answer is B. Anterolateral STEMI. The ECG shows ST elevation in leads V2, V51, AVL and reciprocal ST depression in leads 2, 3, AVF. This is an anterolateral ST elevation myocardial infarction, which is most likely caused by occlusion to the left anterior descending artery. A 54-year-old man presents to the emergency department with a 2-day history of palpitations. An ECG is performed at triage. What is the diagnosis? Options are A. Atrial flutter, B. Supraventricular tachycardia, C. Atrial fibrillation, D. Sinus tachycardia, E. Multifocal atrial tachycardia. The answer is C. Atrial fibrillation. To confirm a diagnosis of atrial fibrillation, AF, arrange an electrocardiogram. If AF is present, the ECG will have no P waves, a chaotic baseline, and an irregular ventricular rate. The ventricular rate is often 160 to 180 beats per minute but can be lower, especially in people who are asymptomatic. The ventricular complexes look normal unless there is a ventricular conduction defect. A 49-year-old woman presents to the emergency department complaining of a headache and palpitations. She is under investigation for suspected pheochromocytoma. On examination, you note she is sweating profusely. Her observations are recorded as heart rate 95 beats minute, blood pressure 210 by 135 mmHg, respiratory rate 20 breaths minute, oxygen saturations 99% on air, temperature 36.8 degrees Celsius. What is the recommended initial management for this patient's condition? Options are A. Intravenous phentolamine, B. Intravenous leptalol, C. Intravenous amlodipine, D. Intravenous nimodipine, E. Intravenous esmolol. The answer is A. Intravenous phentolamine. This patient most likely has pheochromocytoma. In hypertensive emergency secondary to pheochromocytoma, the first-line treatment choice is phentolamine, which acts by blocking alpha-adrenoceptors or calcium channel blockers, clevidipine and nicardipine. A beta blocker, such as leptalol, can be added after sufficient alpha-adrenoceptor blockade. The administration of a beta blocker alone is contraindicated, since inhibition of beta-adrenoceptor-induced vasodilation results in unopposed alpha-adrenergic vasoconstriction and a further rise in BP.